So Colleen, I think the place to start maybe, if you could explain a little bit about the history of private clinics in Canada and why they're coming in sort of regulatory sense. Try that one, see if you can.
Can you hear me? Can you hear me now?
Yeah, perfect.
Well, probably most people know that BC has played an unfortunate and pioneering role in the establishment of private surgical facilities. And I don't call them clinics anymore. These are way beyond clinics. These are facilities that are providing a really broad range of surgical procedures. And so the term clinic is just inappropriate in my view. This sad history is not just unique to BC, but has been unfolding in other provinces, and I understand also in Ontario is really the path is being cleared for a lot of these types of facilities to get rooted in the same way that has happened in other provinces. BC, Alberta, and Quebec are the three provinces that have really broken down, where you've seen barriers broken down to the establishment of these types of facilities. In 1995-96, the first two private surgical facilities were established, one in Alberta and one in BC. The Alberta clinic was called the Health Resources Group. The one in BC was Cambie, and I'm sure everybody knows what I mean when I say Cambie. I'm not talking about the street. And the establishment of these clinics was facilitated by the provincial governments in both provinces for a lot of different reasons that I won't go into a lot of depth unless people want to talk a bit more about it. But from these two clinics in the mid-1990s in two provinces, there are now 72 private for-profit surgical facilities across the country, and that is not a very long time. So the regulatory environment that facilitated the establishment of these types of facilities, I would describe it as being non-existent. There are no laws, there are no regulations, virtually no laws and no regulations governing these types of facilities. Some years ago, when I was trying to find out who regulated Cambie and Falls Creek surgical facilities in Vancouver, I step by step got to the city public health officer, and the regulation that's in place. Of course, the physicians in these outfits are governed by the college, but the facility itself, these facilities themselves, are governed in different ways in different provinces. In Vancouver, the public health officer is responsible, and they do exactly the same regulation for surgical clinics that they do for tattoo parlors. So you can get an idea of what the regulatory framework is.
Well, maybe you could just say a bit more about that. How did that end up then in the court case, and where's that court case now? And people had a specific question yesterday too of why has Brian Day not been charged? And maybe you can talk a bit about that.
Well, people know that there's a constitutional challenge in Vancouver, and one of the things I really want to emphasize is that these investors are never going to stop. The reason I don't call them clinics is because they never stop at being a clinic. They want the whole kit and caboodle, and certainly the pattern that's been established in BC is that these facilities expand. Cambie has 150 doctors working out of Cambie, one facility, that's 150 doctors. And they challenge the law. Brian Day is known as flouting the law. It's been known that he's charging, that his clinic is extra billing patients. In fact, he boasts about extra billing patients, and this is taking place right across the sector, all across the country actually, as Natalie pointed out. So one of the things that happened was that a number of patients in Vancouver who had gone to some of these private clinics for surgery had been billed by the clinics, and so they wanted to get reimbursed for the amount of money that they paid. So they submitted the bill to the Medical Services Commission, which is our OHIP in BC, to get reimbursed. And the Medical Services Commission said, sorry, we already paid that bill. We paid the doctor for the fees that you've been charged for, and so you can't get reimbursed. So in other words, the Medical Services Commission was alerted to the fact that there was double billing going on, which is also known as fraud, which is a criminal code offense. These are allegations, by the way, and don't quote me, I'm not charging him with doing this. These are allegations that have been articulated by the Medical Services Commission. So the Medical Services Commission began to do an audit of all of the surgical facilities, not just Cambie. And the speculation is that Brian Day and a number of other facility owners launched a constitutional challenge in order to kibosh the audit. And so one of the affidavit from the clinics, quote unquote, to the court was that that the Medicare Protection Act in BC was violating people's charter rights to timely medical care, etc. And they went through the affidavit, and at the end it said, and by the way, we would like the court to kibosh the audit. So that's the court said that the audit could take place not at that moment, but in March 2010, and in fact the audit took place in 2012.
So we may, if we get the audit, we may still see Brian Day charged?
Well, I think that this is kind of a strategic question. I think that the guy should be charged under the criminal code if there is evidence that he's got a Medicare on patients. He should be charged. It's a criminal offense. But the court seems to have the attitude that if the constitutional challenge is upheld, then all of these years of these people breaking the law is just going to be, by the by. They won't be charged with breaking the law when the law was in place, if the court finds that the law is not constitutional.
How is the fight back going against them in BC?
There's a province is very serious about defeating this constitutional challenge. So this is good news, because if they weren't as serious as they were, we probably would have some real problems. I don't know if Brian Day is going to win. You can go to the website of the BC Health Coalition and read all of the affidavits. If Brian Day is on the witness stand, I'm not sure if he's going to do himself any favors.
Just a BC problem. When we were at dinner last night, one of the people there was from Quebec, and she said that when she has trouble seeing her doctor, she comes across the river and goes to the Apple Tree Clinic. And I don't know how many people here are familiar with Apple Tree as a for-profit primary health care chain. It's like MCI, the doctor's offices. And a little bit of work that I've done on these shows that they're now linking up with physiotherapy clinics and heart clinics and sleep clinics, and they're getting tied into other large corporations. I don't know if you could sort of talk about the corporatization of this this private facilities sector.
Yeah. I want to talk about Centric but before I do that, I just wanted to say that the audit that was published last year on the Cambie Surgery Center and the Specialist Referral Clinic, which is also a clinic that was founded by Brian Day, they found over 30 days that there had been $500,000 in extra billing and $60,000 in double billing in 30 days. So anyway, Cambie is a pioneer on this path, but one of the companies that's coming up behind them in a big, big way and very, very aggressively is Centric. Centric Health is a company, you may have known it as Allegro some years ago, but it was bought out by basically a company based in San Diego, California, a venture capital firm, run by a fellow by the name of Jack Chevelle, and Colin might know that name. Chevelle is a South African who set up a company in South Africa called Netcare. And basically Netcare was a small ambulatory surgical clinic, and it's now the third largest healthcare corporation in the world. It's gone into Europe, it's in Britain, they own 120 hospitals I'm not sure if what kind of hospitals they are, but 120 facilities in Britain. And this guy is very, very aggressive. He is like, there's red alert around this guy all over the place. He lives in California. He's on the board of Centric in Canada. Centric has bought Lifemark. They have bought a number of surgical facilities across the country, including Falls Creek Surgical Clinic in Vancouver. They've bought a number of surgical facilities in Ontario, Alberta, the Prairie provinces. What they are is a lot of companies in the health sector, they buy in a kind of a silo. Falls Creek, for example, set up another surgical facility in Manitoba, and they stay in their sort of thing. Lifemark, rehab, particularly physiotherapy, but that's what they're involved in. Long-term care, that's what they get involved in, is long-term care. Centric is involved in all of that. They are integrating services. They're mirroring the hospital system in a really significant way. Hospitals they provide A to Z services, or should I should say. Inpatient, outpatient, and so forth and so on. Centric is moving in that direction as well. And their goal is to ensure that if you have a problem, if you need to see a doctor, if you need surgery, if you need physio, if you need long-term care, if you need to buy drugs at a pharmacy, that you can step into their company, into their sphere, and you will never have to touch the public system at all. And that is precisely where they're headed. In fact, now, if you have certain types of needs in the healthcare system, you just have to go to Centric. You don't even have to go to a public provider of any kind. Right now, the majority of Centric's money is coming from the public purse. For example, in physiotherapy, I think it's about 50 or 60% of the income comes out of the public purse. So we are really subsidizing the expansion of this company. But that's not going to last, because when these services go out into the private sector, into the for-profit sector, the money is also going to come out of the private sector. If you look at physiotherapy as one example, physiotherapy outpatient got tossed out of the hospital system. It's gone into a lot of private solo practices, and also into big box companies like CBI and Lifemark. And that was delisted. In BC, I think we were one of the last provinces to see it delisted. They say it's not delisted, but it's a means-tested service. And the impact on people who need physiotherapy has been dramatic. The same thing has happened with home care. Ontario really led the way in home care. And what I mean by that is that these companies, Centric is buying up both for-profit and not-for-profit providers. And so, how can I make this connection between this and home care? I really wanted to make
CBI, go for CBI, okay. Because in Alberta, where they just privatized most of the home care services, one of the two big winners was CBI. I don't know if CBI is connected to Centric's, but
No, it's not.
But it's another huge chain which is developing in Canada.
Yeah, CBI. And do you have CarePoint in Ontario? These are walk-in clinics in Western Canada. It's a network of walk-in clinics, and CBI has bought CarePoint. So you go to a walk-in clinic, if you need a physiotherapist, you're going to go to a Centric physio. So it's a nice little connection for them. But with home care, one of the things that happened was that Ontario introduced competitive bidding for home care. A lot of you will remember that. And with the introduction in BC and this is being discussed across the country, activity-based funding, and the end of global funding for hospitals. What this will do is introduce the ability, quote unquote, the ability of nonprofit hospitals to compete with one another for that public dollar. So you are funded on the basis of volume and case complexity. And that is what your funding is tied to, and you compete with other providers, so the patient becomes a profit center instead of just a sick person, right? So this is something that happened in Ontario with home care, and a lot of the not-for-profits were completely done in by that because competitive bidding takes a lot of resources and time. And if you don't win a bid and you're a non-profit provider, you are out of business. But if you're centric, and this is the system that we're heading towards in terms of surgical services, competitive bidding, then you can just wait it out. When somebody's contract is over with, you bid again, and if you get it, then you're in the money.
And one of the things that I think that even this discussion is showing a little bit is we don't really know what's going on out there in the for-profit sector. We've got Centrix buying up all these companies, we've got CBI buying, we've got, even the Loblaws and their Primacy Healthcare and Shoppers Drug Mart chains buying up. And so there's this huge thing happening, and as you said, there's no regulation on it.
And that's one of the challenges for all of us who are involved in the struggle to defend our healthcare system and our public healthcare system. This is a huge problem, and I know that for many, many, many years we've been talking about things like, should we amend the Canada Health Act? Because that opens the door to going backwards instead of forwards. But since the Canada Health Act has been introduced, what we've seen is a shrinkage in the public footprint in healthcare. When the Canada Health Act was introduced, the public footprint in healthcare was about 75 or 76% of the pie, of every dollar was a public dollar. Now we're down to less than 70, it's about 69%. So we have seen that footprint shrink. And so we need to, and one of the things that's facilitating, it's not just the shrinkage of the public dollar, but it's we don't have regulations. Canada has never had a big private sector in healthcare. The insurance industry was sort of pushed out of the picture, but when Medicare was introduced, we didn't have a for-profit sector in Canada. We had charitable hospitals were charitable providers and so forth, but we didn't really have a private sector. We are getting a private sector now in the absence of regulation, in the absence of the enforcement of the Canada Health Act. The medical associations are, in my view, they have lax ethics and are allowing this to take place. The colleges are accrediting private surgical facilities. They have committees that self-regulate the private surgical facilities. This is completely unacceptable. We just have this environment where we are so not ready for what is happening. So the debate that we have to have, in my view, is, do we begin demanding regulations? Do we want the private sector to be regulated? I mean, we don't want the private sector here, and that's been the dominant theme in our thinking, and that is the right way to look at it. But they are here. Centric is here. They are being funded by money from California. They are expanding so rapidly. People here, I'm sure, are aware of the fact that they tried to acquire Shouldice, the Shouldice Hospital, and were because of the pushback from people in Ontario, that didn't happen. That was really great. But you know what? Ontario is not British Columbia. Trust me on that one. We have so many problems in BC with these types of facilities. So and other provinces as well. Alberta is the same way, Saskatchewan, all of these provinces they're basically looking at this, and this is the thing that's driving the argument, is that these companies are providing Medicare Plus, that we will always have the public system. You'll always be able to fall into the dirty, grubby hospital if you can't get a private facility. So don't worry about it. But these other providers are going to provide lush settings, the best doctors. Brian Day is the best orthopedic surgeon in the world. Just ask him. And so this is the challenge. Do we want them regulated, or do we not? That to me is the question.
Anyway, we'll leave that question for the moment. Thank you very much. Look forward to your report. I think it'll be great. Thanks very much.
Thank you.